Hey everybody, Dr. Justin here with a case study update. We are going to change how case studies for the TrapEAZE technique are done from this point forward, and I wanted to make you aware of that so you have something to look forward to. So what we're going to be doing is I am going to be inserting, as a part of every case study video, I am going to be inserting the patient's prognosis. So prognosis, as you may know, it is a very difficult thing to do. A lot of doctors never offer their patients a prognosis just because it is that difficult. However, based on all of my collective upper back pain treatment experience, I am going to put my foot into the ring, and I am going to include a patient's prognosis with every single case study. So the prognosis is going to be demarcated as part of the actual video name, so you'll be able to identify it just by looking at the video name. Of course, I will mention that as part of the actual case study itself for at least the very first video that we do. And then at the very end, once we actually have a patient testimonial, you'll be able to see how accurate my prognosis was. So it's going to be very interesting to see what happens with this. How right or how wrong can I be? I don't know, but you're going to find out when I do. So anyway, keep on watching. Lots of more exciting case study videos coming up, now with prognosis. Otherwise, great to see everybody. Thanks for watching.